Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 560 of our pharmacotherapy series, which majors in schizophrenia. JPJ has been continued on the combination of aripiprazole monohydrate long-acting injectable antipsychotic and haloperidol over the next 8 years. Over time her symptoms have returned periodically, never requiring a hospitalization, but necessitating gradual increases in her haloperidol to 15 mg per day. JPJ now presents to the clinic with shakes in my hands that are bothering her. During the physical examination, JPJ is noted to have facial grimacing, darting movements of her tongue, lip smacking, and twisting movements in her hands. The movements in her hands seem to disappear when she grabs an object or performs other activities with her hands. What is the most likely cause of these movements in JPJ? These movements are most likely an early form of tardive dyskinesia. Haloperidol, as a high-potency first-generation antipsychotic, has a high risk of causing this movement disorder over time, approximately 3% to 5% per year of use, or 24% to 40% risk in JPJ. The symptoms we are observing in JPJ are consistent with those movements seen in tardive dyskinesia, which presents with arrhythmic choreodotoid, snake-like movements of the orofacial areas, limbs, and trunk. The fact that the irregular hand movements stop or decrease when JPJ performs a conscious task with her hands is also indicative of tardive dyskinesia. The next question reads, what can be done to treat the tardive dyskinesia seen in JPJ at this time? Although there are no definitive treatments for tardive dyskinesia, there are some strategies that might help to alleviate the problem. Slow decreases in her haloperidol dose over time may help these movements decrease. A rapid reduction in the dose may acutely worsen the problem, so this should be avoided. If the movements persist despite lowering the dosage or discontinuing the haloperidol, there are some data supporting the use of clozapine to treat the dyskinesia and schizophrenic symptoms. This should be considered cautiously in light of the other concerns related to clozapine treatment. JPJ's psychiatrist decides to start JPJ on clozapine and remove all other antipsychotics in light of her tardive dyskinesia and past failures and adverse effects with other antipsychotics. What adverse effects of clozapine should be monitored for in JPJ? Any patient started on clozapine should be monitored for agranulocytosis and metabolic adverse effects, among others. As JPJ has a history of metabolic adverse effects, weight gain, increased glucose, and increased triglycerides, with other antipsychotics, these are of particular concern with using clozapine with her, as clozapine has the highest risk of these adverse effects. JPJ should also be counseled about orthostatic hypotension, sedation, anticholinergic effects, especially constipation, and sialorrhea. The next question reads, prior to initiating clozapine therapy, what laboratories and other tests should be performed on JPJ? Clozapine therapy requires a baseline absolute neutrophil count prior to starting the medication to ensure the patient has an adequate number of neutrophils prior to initiation. In addition, her weight, waist circumference, serum glucose, HbA1c, and lipid panel should be measured to monitor for the development of metabolic adverse effects. Baseline liver and kidney function tests should also be measured. A pregnancy test should also be performed, especially if there is any chance that JPJ could be pregnant. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it, and to share it widely with your peers. Please leave your comments at the bottom. And if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arora, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 561.